Hi, Christopher Westfall. Got a lot of information to go over with you today. What can you add to your Medicare Advantage plan which won't make it so bad? We'll go over that. And what is the timing? When do you have to do what on your Medicare Advantage or Medicare supplement product? We'll talk about that. But first, there's a nurse out there on the interwebs warning, and I'll show you the video in just a second, warning people do not enroll in this particular type of plan. She knows from the inside, and she'll share her insight with you in just a moment. Then there's a new Medicare scam. This is legit, and this is brand new that's happening. It'll shock you what they're doing with artificial intelligence right now and why they're calling and not just asking for your Medicare number like they've done in the past. This time it's new. Turning a whole new page on scams. We're going to go over that. You really need to know that information. And then there's an article that came out in MedPage today. Really like these people and their in-depth research. This is called Medicarelessness. And you should see it. It's in the full context of where we've started with Medicare and where we are right now. It's short, but it's very pithy, and I think you'll enjoy it. Then the American Hospital Association with a new warning will zero in on what they've identified happening with Medicare right now and how it may affect you going to your hospital if you need to. And then fixing the holes in Medicare Advantage. Are there things that you can plug in at very, very low cost, especially if you have a zero premium Medicare Advantage plan that could take away some of the risk that you're exposed to that we've covered thousands of times on Medicare Advantage? And then when can you do what? We're going to go over the timing and then some real stories from you and the audience. So stick around, a lot to go over today. Just by way of an update, my mom did have her knee surgery a week ago today, and she was out of the hospital within 3 or 4 hours. It blew our mind. And she was so thankful for the procedure and how easy it went. So she is recovering at home, and I'm checking on her by stopping in there twice a day, but she is up and around doing everything. It's just incredible, doing great. Went home the same day from full knee replacement surgery, doing good. And here's the video from a nurse, and this got wind on the internet and started getting spread out there about what she's saying about Medicare. What? You be the judge.
I was driving home. I saw a big billboard that said, enroll in a Medicare Advantage plan and you'll get a free gym membership. And it reminded me to give you guys your yearly reminder to not enroll in a Medicare Advantage health insurance plan. If you're not aware, Medicare is the health insurance that is paid for by our government, by our taxes, and given to our elderly populations and to some of our disabled individuals as well. When those Medicare health insurance plans are managed by the government, that is just called Medicare, or some of us call it traditional Medicare. However, a while back, the government started allowing private insurance companies to distribute these plans as well. That means that for-profit health insurance companies like Blue Cross Blue Shield, Humana, United Health Group are able to make and distribute Medicare plans and then get reimbursed from the government with our tax dollars. These are called Medicare Advantage plans. A lot of healthcare workers really don't like these Medicare Advantage plans because they tend to deny a lot of really important care that traditional Medicare would have covered. Now, here's my little disclaimer. Never say never, right? There may be some instances where a Medicare Advantage plan offers some additional benefit that might be more beneficial to a patient than traditional Medicare. However, I am telling you guys, if you have an elderly family member, friend, or a disabled family member, friend who is about to get on Medicare, be very careful with the Advantage plans.
Be very careful with the Advantage plans. So that's her story, and it's trending big on TikTok. Of all things. And then there's this new Medicare scam. This will really, it turned my eye. Like, this is just the most incredible thing that they're doing with you on the phone. And I had a client write to me the other day, and they said, somebody called me on the phone and they offered me about $100 less per month for my Medicare supplement plan. Is this true? Can I actually do this with a company? And here's why. This is exactly what's happening, and you need to watch this.
Nearly 1.5 million people here in Arizona relied on Medicare this year, but scammers, they are working overtime as we get closer and closer to 2024. So all new for you this morning, our Let Joe Know team is sharing how Medicare users are being targeted.
With the clock winding down on Medicare's open enrollment period, scams are ramping up.
The advisor scam, where it's someone calling to help you pick your plan, to figure out what your coverage should be.
John 𝗲𝗏𝗏 is the Director of Product Management at Transaction Network Services. TNS analyzes more than 1 billion calls daily, identifying robocall trends and scams. 𝗲𝗏𝗏 says scammers are flooding the country with calls posing as Medicare spokespeople there to help.
Getting a relationship and enabling the consumer to trust the fraudster or spammer to then share data, which then leads to other account takeover activities or identity theft.
Posing as advisors, 𝗲𝗏𝗏 says callers are also using a supplemental coverage scam, acting as a sponsor to help you register for extra programs and services at a discount. In reality, you're never registered for anything. The scammer takes off with your info. 𝗲𝗏𝗏 warns not only are Medicare scams becoming more frequent, they're also being used as gateways for other scams, using artificial intelligence to get hold of your voice.
The ability of something to say, can you confirm your name? Can you confirm your information? Do you accept this idea? Yes or no? And that can become a recording that could be used by an AI bot to now do impersonation attacks on behalf of that individual.
Protect yourself by treating your Medicare card like a credit card. Only give it out if you contacted Medicare or to doctors and providers. Don't give it to unknown or unexpected callers. Contact your local senior Medicare patrol office before giving out information. If something seems suspicious, trust your gut. Hang up and call Medicare yourself. We put links and phone numbers for local offices as well as other prevention tips online at abc15.com/.
Here's something else that they're doing, and someone did this to me the other day, and it'll make you think twice. And what happened was, got a call, and the caller ID said it's from Google. And the person on the phone said, hey, this is Google headquarters. Somebody just called in here pretending to be you. We just want to verify that you are who you say you are. We're going to send you a text message right now from Google with an authentication code so that you know that I know what the code is. And many times people will fall for this thinking that this is called two-factor authentication, where you get a text from somebody that you're trying to do business with, and you're proving to them that you got the right text. Well, they're doing this now in reverse. So if somebody pops up on your caller ID and it says that they're from Medicare or Washington, D.C., that can be faked so easily. I can't even tell you. Even with our outbound caller ID, our office number, we can put in the caller ID space anything we want, and so can they. So if they say that they're calling from Google, or they're calling from your bank, or they're calling from somewhere else, make sure you know the callback number and you call them back. And here's one more reminder. This is real quick before we get into the crux of what's going on about giving out your Medicare number. This is often what they're looking for.
An important message from Medicare. Fraudsters, they're out to get your Medicare number so they can bill fake claims and your good name. Don't give them that chance.
Just calling to confirm your Medicare number. You have your card available?
For example, the caller says they're from Medicare. Watch out. It's probably a scam. Don't give out your card number. And always check your claim statements for errors. Report fraudulent charges to 1-800-MEDICARE. Guard your card. Learn more at medicare.gov/fraud.
Yeah, don't give out your number, your Medicare number, to anybody ever. If you call them, you can give it to them. If you call the folks at Medicare, assuming they're not on strike still. And you should see this going on right now. This is an amazing article, and it's written, it is over at MedPage today, talking about Medicarelessness, and I'll just hit the highlights for you. 1973, New York Times published an editorial called Medicarelessness, questioning the allocation of public funds with what they called special interest groups, specifically for patients with end-stage renal disease. Just 2 months later, President Richard Nixon had signed the Medicare Amendments Bill, which expanded coverage on Medicare for dialysis and transplantation for anybody of any age. The editorial argued that the benefits of prioritizing funding for expensive therapies like dialysis over other societal needs were unclear. The benefits. At the heart of the issue was whether legislators, given limited resources, were acting responsibly when deciding how to prioritize your public money. Exactly half a century later, the question of Medicarelessness is more relevant than ever. Although in an entirely different context, Medicare has expanded dramatically since its inception in 1965, supposedly to improve its efficiency. Congress eventually created the Medicare Advantage program in 2003. This new program, which is publicly funded but privately administered, ushered in a new era of Medicare privatization. With the advent of Medicare Advantage, the insurance industry has pioneered new in evolving strategies to maximize profits that have led to widespread accusations of profiteering and fraud. I'm linking to this article. You should click on the actual hyperlinks that these blue things are and see report after report after report. It's in the description below. In 1973, Medicarelessness referred to reckless government spending on what became life-saving treatment. Today, I believe it's more appropriate to assign this label to reckless spending used to bolster corporate profits. And this is written by a doctor. I'll show you the profile in just a second. In a just society, healthcare is an essential service that benefits all. The U.S. stands apart from other industrialized nations in that healthcare is not guaranteed. Medicare represents an attempt by our country to partially remedy this injustice. Partially. It not only provides care to some of the most marginalized members of society, the elderly and disabled, it also helped to desegregate the healthcare system, promoting racial equity. Despite Medicare's historic achievements and remarkable popularity, 84% of its beneficiaries view it favorably. If you're on original Medicare, you do. Government-controlled healthcare remains a controversial subject. Politicians in both parties have sought to increase the role of private insurance in Medicare, under the conception that care would be cheaper and more efficient in a market-driven system. Did it work? Contrary to these claims, Medicare Advantage has raised costs for taxpayers using higher patient risk scores that are not justified. Medicare Advantage only saves money for insurers who use a range of techniques to extract profits at the expense of patients, such as instituting highly limited networks and arbitrarily requiring prior authorization for many services. Each year, Medicare Advantage rejects millions of authorization requests. Why did I say that word that way? Of which about 1 in 7 would have been approved under traditional Medicare. But the most egregious method of profiteering, in my opinion, this is the doctor, is the practice known as upcoding. Now, many people that are on Medicare Advantage tell me all the time, look, if they're taking more money on profit on the back end, that doesn't really affect me. Well, if you're a taxpayer, it does. And if you're part of the working class people that are subsidizing Medicare by our payroll taxes, it should. Medicare Advantage insurers receive payments that are determined in part by a patient's diagnosis. We've covered this before. The more diagnosis codes submitted, the higher the payment. Medicare Advantage plans have taken advantage of this, no pun intended, inflating the number of diagnoses on patient charts without providing additional care. Upcoding is so widespread that the Department of Justice has investigated or sued nearly all Medicare Advantage insurers for either this practice or another form of fraud. This is only unique to Medicare Advantage. It is morally indefensible for billions of taxpayer dollars allocated for healthcare to be siphoned off as corporate profit. Margins for Medicare Advantage plans are significantly higher, study shown linked below, than other types of insurance, to the point that some companies are leaving their employer-based insurance plans altogether and focusing just on the government plans. In 1973, the New York Times questioned programs designed to benefit a medically needy special interest group. Now we have a program designed not to heal the sick, but one that instead ends up feeding taxpayer money into a far from needy special interest group, insurance companies. Not only does Medicare Advantage cost taxpayers billions, it doesn't even work for the many patients that Medicare was created to serve. Despite low premiums and benefits that MA plans aggressively advertise, I'll link to that already shown right there. The reality is that costs are only manageable when beneficiaries are healthy. If they become ill, their insurer can deny payment for services or restrict access through limited networks, often forcing patients to pay out of pocket, which we'll cover in just a second how you can solve that, or forego treatment altogether. According to a 2021 government accountability report that we've covered, patients in their last year of life disenrolled from Medicare Advantage plans to join traditional Medicare at more than twice the rate of all Medicare Advantage beneficiaries, potentially driven by limitations accessing specialty care under Medicare Advantage and by unforeseen expenses. Let me just dial into that a little bit. According to this report, patients in their last year of life, when they need the most medical care they can possibly ever need, disenrolled from Medicare Advantage plans to go back to traditional Medicare at a rate more than twice of all other Medicare beneficiaries disenroll. And understand, if they're in their last year of life, they've got all these conditions going on, hospitalizations, hospice, all the rest. They can't get a Medicare supplement plan because in most all states, they're underwritten. No, they go back to original Medicare knowing that they're going to pay 20% of all the Part B costs. And here's the study that went over that. It's linked in the description. They knew they're going to pay those costs, but still that's better having Medicare pay for 80% rather than a Medicare Advantage plan not paying for any of it. Proponents of Medicare Advantage, like many of my agent friends who only sell it, claim that privatization promotes innovation and efficiency, but its role in healthcare appears questionable at best. Doctor saying this. The reality is that no matter what, profit-driven corporations will likely never put the interest of the public above those of their shareholders. Privatization allows the government to shirk fiscal and moral responsibilities at the expense of those it claims to serve. It is myopic strategy that benefits corporations yet keeps costs largely public. In short, the privatization of Medicare is Medicareless. Medicareless poses a much greater threat in 2023 than it did in 1973. We are thoughtlessly subsidizing the private insurance industry at an extravagant cost to the American taxpayer and dismantling a vital and beloved public program to do so. We must accept that life-sustaining services should remain in public hands to safeguard citizens from the gravest injustices. You'll see in the comments, when I get to them in just a minute, how this is really impacting lives. I've shared with you hundreds of stories, going to share more, because it's not just an anecdotal thing. It's really affecting my clients' lives who've insisted they'll stay healthy forever at 65 and just give me that zero premium plan. At least they know what they're getting into when they go with us. Medicare remains a potent symbol of our most sacred democratic principles: equity, equality, dignity, and self-determination. We can no longer afford to be Medicareless, both ethically or financially. We must say no to privatization. This doctor, Cheryl, is a nephrologist and a bioethicist, ethics in medicine. Imagine that. She currently serves as a clinical professor of medicine and special lecturer at Columbia University, and an adjunct clinical professor of medicine at the Icahn School of Medicine at Mount Sinai in New York. Wow, she's got some credentials. Got a lot to get to, but if you found anything ever helpful, even that much of a smidge in any of my videos in the past, please do me a favor and like this video and share it with somebody who may be making a life-changing decision. I would appreciate it. Computer is slowing down. Wonder if it's messed up the video. There we go. And in a new study, this is a report from Healthcare Finance Online, and I'm linking it in the description. Hospitals want CMS, that's the Center for Medicare and Medicaid Services, to correct Medicare Advantage plan policies on coverage. And it's talking about the final rule, which is something that Medicare has proposed to happen in 2024. But is it actually going to do it? We are deeply concerned that these practices of the Medicare Advantage plans, this is the hospital writing the letter to CMS. These practices, talking about prior authorization, will result in the maintenance of the status quo where Medicare Advantage organizations apply their own coverage criteria that is more restrictive than traditional Medicare, proliferating the very behavior that CMS sought to address in the final rule for 2024, resulting in inappropriate denials of medically necessary care and disparities in coverage between beneficiaries in Medicare Advantage and those in traditional Medicare. That's been known, that there's a disparity in coverage between Medicare Advantage and traditional Medicare. Everybody knows that. Even the agents that are lying to you, telling you that it's all the same coverage. Everybody knows it's different. This rule proposed by CMS, which should be going into effect in 2024, was supposed to fix that, but it's not. The American Hospital Association wants Medicare to issue clarifications on coverage and make it clear that the flexibility for Medicare Advantage plans to supplement traditional Medicare rules with additional internal coverage criteria is not applicable for medical necessity reviews of inpatient admissions, because they want you to be admitted if you want to be admitted and need it, and level of care decisions, and should only be used in certain limited circumstances, which means you got to use the Medicare rules, not just your own. When you go to our website, pardon me for a second. I need to cover this because we have over 1,600 people waiting for us to call them back, and all of them could have gone and booked an appointment. We have everybody in our office on the phones, on appointments, around the clock, 10 to 12 hours a day, 6 days a week, doing everything we can to assist everybody. Those people who found their way to book an appointment, we already have an appointment with. If it's going to be too late for you, I'll tell you in just a minute. I'm going to touch on every possible scenario that I can think of for where you may be and how this may affect you. But if you go to our website and you click the button to get Medicare help, you could just land on our calendar and be just fine and not have to wait for callback. Today, I saw somebody saying, I'm calling you back twice. You didn't call me back since this morning. Like, okay, all year long, you can start or stop a Medicare supplement. Let me be clear on that. All year long, not during the Medicare annual election period. You can start and stop a Medicare supplement and change companies anytime. Before December 7th is not that period. Between October 15th and December 7th, you can get onto a Medicare Advantage plan or change it or drop it. You can sign up for a Medicare Advantage plan for the first time. If you don't know how to do that, I'll give you a link that you can do that on your own if you'd like, or with our help. Or you can change plans to a different one, or you can drop it. Don't drop it without having something to back you up, namely a Medicare supplement plan. And we can go through that. It's covered on my website. Just go to the website and click the Medicare Help button. But then January to March 31st, there's another period of time where you can change Medicare Advantage plans. If you don't like yours, you can shop the market again. You can also drop one, drop a Medicare Advantage plan from January to March 31st and go back to original Medicare if you went and did it in the right order that we cover on our website and got a Medicare supplement plan, so you have a soft landing, as they say. Don't just jump from the frying pan into the skittle or whatever it's called, or the griddle, and jump back onto original Medicare with no coverage at all. That's not a good way to go. At least have something. Now, here it is from the Medicare and You Guidebook. I'll make this large so you can see it. Medicare and You Guidebook goes over these timelines again. This is from the large print version. You can find it at medicare.gov. Again, from January, and some people don't believe me on this, so January 1 to March 31, if you're in a Medicare Advantage plan, you can change to a different Medicare Advantage plan during that time of the year, not December 7th, during the first quarter of the year, or switch to an original Medicare and join a different Part D standalone plan if you want to. Any changes that you make during that first quarter will be effective the first of the month after the plan gets your request. But again, don't do this right here unless you have secured coverage with a Medicare supplement plan, which likely means you'll be going through underwriting, which have a solution for that too. Don't go anywhere. Now, if you have Medicare, you had two choices when you got on it. You could either, this is from the Medicare and You Guidebook, you could do original Medicare, or you could do a Medicare Advantage plan, which replaces original Medicare. It has limitations on doctors, networks, usually requires a referral to a specialist, and they have the limitations like prior authorization, limitations on where you can get care and all that. If you add something to either one of these, and this is what we do in our office, it's so funny, somebody will comment and say, I wish I could find somebody who could help me with this type of insurance. And meanwhile, our contact information has been all over the website on the video that they're commenting on. But I digress. On original Medicare, it does not cover 20% of the outpatient cost. And this is where the majority of the costs are. The inpatient, not a big deal. $1,600, not a big deal to go inpatient if it's a major thing. But the supplements cover that too. So that's why you would want to get a Medicare supplement policy. And that's what we help with. On Medicare Advantage plans, they have two gaping holes. One is a massive amount of money that you would pay if you go into the hospital. More than, in many cases, what it would have been on original Medicare with nothing, with no insurance, no Medicare supplement or not, or Medicare Advantage. Medicare Advantage usually costs more to go in the hospital, sometimes more, sometimes less. But you better go to a planned hospital. You can't go out of the plan's hospital. And then there's the cost of cancer. I covered this recently in depth, and I want to talk to you just for a second about all of you millions of people that are on Medicare Advantage and what you should be considering adding to the Medicare Advantage and why. Please watch this. sure you look into a hospital indemnity plan. What does that mean? That can take care of the massive copays that you could be exposed to on a Medicare Advantage plan. Some of them I've seen as high as $500 a day to go into the hospital. If you go into the hospital and it costs you $500 a day for 5 days, that's a pretty significant difference than your original 0 monthly cost that you thought you were going to save money on. I think you'd agree. Hospital indemnity plans, if you can find one in your area or you can qualify for one, and yes, we help with those too, they can, for about $30, $40 a month, eliminate that threat for you. They can take care of the ambulance ride, they can take care of the hospital charge in full, and they pay that money to you, by the way. That's one of the big old caveats on Medicare Advantage. You need to plug that hole if you don't have that money in savings and ready to go each and every year. And remember my family's backstory. You have a big cancer situation happen at the last quarter of the year, and then it carries on into the first quarter of the next year. That means you're going to face 2 maximum out-of-pocket experiences, not just one. So take that max out-of-pocket you see that they show you, and then double that. And that's your really worst case scenario. The second thing you need to be aware of and fill that hole is cancer. Cancer treatment on Medicare Advantage is very, very, very costly if you can get in at all. If you have an oncologist, just dealt with a comment on YouTube. Somebody was talking about their oncologist was gone from their Medicare Advantage HMO. They have none in their county. What are they going to do? It's a real problem to get real high caliber cancer treatment centers that will accept Medicare Advantage. It's almost non-existent. So what if you want to go out of the network? You have to pay for it out of your pocket. Do you have money to do that? We have a cancer plan. Just met a fellow agent the other day who told me about his experience. He literally had cancer and had a cancer plan, because I do, all of our agents do. A cancer plan paid $50,000 for his treatment. Now, his treatment was no big deal. He got over his cancer. But if he needed that money to go get treatment outside of what his health plan would pay for, then it would be literally life-changing. So if you're on any Medicare Advantage plan and you look in your summary of benefits and you see that chemotherapy, radiation, and all that is going to charge you 20% of the total bill, that's just like having no supplement, no Advantage plan whatsoever. That's what original Medicare makes you pay, 20% with no limit. The only benefit of an Advantage plan is you have your max out of pocket, like a stop loss. Again, double that for a worst case scenario. But if you don't want to deal with those costs, or remember, they'll only pay the 80% if you go in network and you obey every rule that they say for whatever course of treatment they say is the cheapest. If you want full access to go anywhere you want, pay for any treatments that your doctor really says that you need cancer insurance. We have a cancer plan that's available in most parts of the country. The only caveat is you have to have been cancer-free for the last 5 years, and then you can get the cancer coverage. It's also good for people on Medicare supplements who can already go to any doctor in any hospital in the country with no restrictions and everything's covered. Medicare supplement world, it's good because many of the drugs that are given for cancer these days are given through Part D, or you let your cancer insurance give you a check, and with that money, then you pay it. Because cancer runs rampant in the senior community, as you probably already know. So just to reiterate, there are things that you should add to either one. On original Medicare, you should add a Medicare supplement plan so you're not exposed to an unlimited amount of money. And then on a Medicare Advantage plan, you should have a cancer policy. I know an agent in North Carolina, she does a lot of Medicare Advantage, and she will not sell someone a policy or help them if they don't first agree to take care of the cancer situation, because it is a massive exposure on Medicare Advantage. And again, cancerplan.us, and we can tell you what those rates are. It's not available in the state of California for people over 65. So if you're turning 65 in California, you better secure your cancer plan before that. And it's just California rules. I don't know why. I want to go over a couple of resources here for you real quick. I'm going to get into your story so you can see what other people have been sharing with us. It's quite ironic. If it's before December 7th, then you need to change or start a Part D drug plan, or if you're brand new to Medicare and you're looking for your Part D drug plan, you can use our site called startpartd.com. It's a do-it-yourself site approved by Medicare that has all the information in there. It doesn't have all the plans because we don't contract with all the plans on purpose. And you can see on the left-hand side, once you put your drugs in your pharmacy in there, on the left-hand side, it shows the max out-of-pocket for the year, not max, excuse me, the estimated total out-of-pocket for the year, and you select that plan should be good for you. And yes, some of them are very inexpensive this year. You might be shocked to see that. If you need to get on a Medicare Advantage plan, or you're on one and you want to compare those plans, you can do so before December 7th. Or if you're on one and you want to compare it to another one to switch what's maybe possible out there, you can also do this during January to March 31st at MedicareAdvantageNearMe.com. If you're new to Medicare, you can do this 3 months before and 3 months after you've started your Medicare Part A and Part B. You can look at MedicareAdvantageNearMe.com. There you have an option. Also, you can book a time with our staff so we can go over that with you manually. If there's time available in that calendar, you can see the calendar there, or you can do it yourself. Very simple. When you go to that website and you click through, just make sure you're on the appropriate tab that says Medicare Advantage and prescription drugs all together in one plan in the center tab. If you want to see how to get underwritten for a Medicare supplement policy, I go in great detail at SeniorSavingsNetwork.org/underwritten. If you don't remember any of this stuff, just come to the main website, SeniorSavingsNetwork.org, and you'll find this. Again, the cancer plan information, if you're on Medicare due to disability, I've got several hundred people waiting for calls on that. Go to MedicareOnDisability.com. It'll explain to you what your options are depending on your state. Medicare supplements, supplements, Medigap plans are not available in every state if you're under 65. So we'll talk about those. Here's some comments I wanted to share with you. I just found you today and subscribed. People need to know the truth about Medicare Advantage plans. My husband was on one of those and it was fine until he was diagnosed with throat cancer. Then it was a different story. I was a nurse, so I knew to keep my Medicare, but he wouldn't listen to me or my nurse friends. We'll be calling you in January. Yeah, people on the inside, they kind of know, the medical professionals. I'm dissecting a presentation done by a doctor who was inside the Medicare Advantage world right now, and you've got to hear what he has to say. Make sure you're subscribed to this channel for updates about Medicare, because all this stuff is very, very timely. Another one, pushing Medicare Advantage has gotten out of control. I'm a certified volunteer Medicare consultant with the SHIP program, so am not about to be scammed into Medicare Advantage. That said, I'm stunned at the number of phone calls I'm getting from those trying to do just that by telling me that I qualify for extra benefits. Last Friday, I got over 35 calls on just that one day. And remember, calling somebody about Medicare Advantage is illegal. The agent could lose their license and should lose their license. But they've got all these Pakistani firms and Indian firms and Filipino firms, no slight against the nationality, but that's where they are. And they're generating these leads and they just give them to the agents and say, hey, we got this person who said they're interested. And the agent's like, I don't know where it came from. I don't ask, you don't tell. It's sick. Last Friday, 35 calls in one day. Hopefully I just figured out how to block them, which I hated to do because I know it will block some that I do want. You have to do that. I'll try unblocking on December 8th to see if the onslaught is over. Very good plan. Maybe we'll review those call blocking apps and then talk about them. I called business that I have drug plan with. Everything was fine until, it's talking about calling your Part D drug plan. Called them until the end when she tried to talk to me about Medicare Advantage. That made me angry and I said, not interested. If you go to my website to get a Part D drug plan, which you can do 24 hours a day on your own, you'll see a message scrolling across the bottom. Understand they're going to call you and they're going to pitch you on Medicare Advantage to give up your original Medicare and go to the private plan. And they'll say, hey, why pay for this drug plan? You can get it for free. I got a letter from the medical facility that I've been going to for 2 years for treatment for multiple myeloma. Remember what the senator said? Medicare Advantage is great till you figure out you've got something like multiple myeloma, the big stuff. And they said that in January, they're no longer taking Advantage plans. Yeah, we covered many, many hospitals doing just that about 2 weeks ago on this channel. Make sure you're watching the other videos. After I saw where medical facilities were denying coverage, the letter made sense. Saw it on this channel. Luckily, I have supplemental insurance and can go anywhere. Christopher, please do a video about this. Warn retirees, and I've been meaning to do this. You are not required to sign up for your retiree health plan. Whether you sign up for your retiree plan or not, you are still responsible for paying your Medicare Part B premiums when you're retired. That's right. If your employer only offers Medicare Advantage, turn it down and go buy your own Medicare supplement plan during your initial enrollment guarantee issue period, which is 6 months after you've started Part B, or anytime if you can go through underwriting, which we've covered. Just go to our main website. It'll guide you right there, and you can get on our calendar. We can help. And keep your original Medicare. You will be glad you did. This is something we've been helping organizations with behind the scenes on just some strategy and some inside information and some stories and some backstory about Medicare Advantage and what could potentially happen to these employee retiree groups if they go Medicare Advantage. Many states, many cities, many municipal organizations and IBM and AT&T and all the rest pushing everybody into, and Boeing this year, huge, into their Medicare Advantage. Some of them look great, but what they give in the big print, they take away in the small print. Things like prior authorization and restrictive networks. And just because it says it's a PPO does not mean you can go anywhere you want to. It means that you could, if the provider agrees to accept their fee schedule and bill them directly, the insurance company, on your behalf. That's a lot of ifs. But yes, you can do anything that anybody else on Medicare can do. You are not restricted to just do what your former employer says now you should do. And let me just give a little bit of a nugget to you. This is true. Somebody makes a lot of money when there's a Medicare Advantage deal going on. Somebody does make a lot of money. And if your employer is involved in this, I'm just saying somebody's making some money there because there's no agent involved. And the money, the marketing money with Medicare Advantage is already there. So if they're shoving everybody from a plan that used to cost them millions and now won't cost them anything because you're in a Medicare Advantage plan, somebody's making some money there. And you might want to look at your own private plan and keeping original Medicare. So true. These denials have happened to me specifically to the point that my doctor and I sued an Advantage plan. The suit took 9.5 months, and then the court found for us. And the plan sent a letter announcing they were approving the procedure like they just figured it out and decided to approve my procedure because they were so great and benevolent. I was then past the open enrollment period and had to continue with this plan until the next year. Go with original Medicare and a supplement. No contest from someone who's been through it. I was a nursing home administrator for 30 years. Now I work for a state Medicaid agency. Advantage plans make money from denying services a person is eligible to receive and for which Medicare recipients generally pay more to receive. Medicaid managed care recipients receive far less services. Families don't have a clue about Medicare and Medicaid. It's complicated, even for those of us who have worked in the industry for years. Managed care plans for Medicare and Medicaid should be outlawed from somebody on the inside. Just their opinion. I worked at a nursing, this is a different person. I worked at a nursing rehab that shut down. The financial staff called "You care, you suck." I repeatedly was warned about the problem with Advantage plans while I was decades away from Medicare. Patients who weren't physically ready to go home were forced to go home, which, yes, sends people back to the hospital when they aren't ready to function at home. We've covered many stories about that. And here's one, seems kind of long, but it's very good. I treat seniors in rehab for them to recover from illness and injury in a skilled nursing facility. We get so upset, the entire staff. Advantage care plans are actually a complete disadvantage from the moment the person enters the hospital. Many of them report getting a phone call saying that they will have 21 days in skilled nursing for rehab. In fact, we see most of these insurance companies issuing a notice of non-medical coverage within their first 5 days, which is what the lady who testified in the Senate said. Exactly the same thing. Which means that is all the insurance will pay for the rehab in the facility. The rehab is 5 days a week therapy, as well as the paying for the nursing care. We have had patients that were forced to go home because they can't afford private pay, typically around $300 a day, that can't get out of bed or complete any self-care. So the family scrambles trying to figure out how they're going to care for them. I'm working with 2 people right now that started out as comments, and please don't put a comment in there if you need help. Go to the website so we can actually help you. Comments, there's thousands of them. I won't get to all of them, but we're trying to help people. They can't get out of bed or complete any self-care, so the family scrambles trying to figure out for them how they're going to get care for them. That requires some family members to try to figure out if they can even keep their job and be thrown into becoming a full-time caregiver. When you think about how much stress this causes on the insured family, the insured person and their family, if they are blessed to have family that can care for them, this is going to lead to more family crisis in the United States. Many family members have no medical knowledge outside of a cold, flu, or sprain. This is somebody who treats seniors in a rehab facility when they're on Medicare Advantage. That's where you're getting those stories, only on Medicare Advantage. I've been on traditional Medicare and Plan N plus a dental vision hearing plan for a year now. Very happy with Senior Savings Network. Got to give you some positive news in here. They're very helpful and responsive and not just to make a buck. Chris and his agents know what they're talking about. I trust them completely. Oh, it works. Thank you, darling. Name was actually Darling. I so appreciate your team's experience. Your follow-up and follow-through is amazing. Thank you. Now, if you've just left us a voicemail during the annual election period, you're not thinking that this is the case. You're thinking we don't follow up with Jack Diddley squat. But I'll tell you, if I had 2,000 agents, they would all be busy trying to help people. We don't have 2,000 agents. We're a small team that does the best we can. That's why I want you to know, for most all of you, you don't just have December 7th to do something with. Medicare supplements we can do all year, and we will methodically work through trying to help everybody who's reached out for us. If you need a Medicare Advantage plan because you can't afford your supplement anymore, you can get that too. You can go to MedicareAdvantageNearMe.com, MedicareAdvantageNearMe.com, and you can get help that way. But if you start at our website, our main website, you'll find what you need. And you can get on our calendar instead of leaving voicemail after voicemail after voicemail, which is not very efficient, but we're doing the best we can to get through it. Let's see. Thanks for the information. I appreciate the information on how to find out if someone has changed my enrollment. This is a comment that I answered the question. How do I find out if somebody's changed my enrollment to a Medicare Advantage plan without my knowledge? This happens a lot. Yes, I did not understand the choices when my wife went on Medicare. But when my time came up, you helped us both change to original Medicare with a Plan N. Thanks again. Hoorah. Go to mymedicare.gov. Sign up for an account there. You can see your explanations of benefit. You can also see what your Part D drug plan is if you're on a Medicare supplement. See if it got switched over. Now you have to wait until the January we'll actually switch over to see it there, but you'll see your secondary coverage. You'll also see your Medicare supplement there once it's fully in force. And you'll see your Medicare Advantage plan or if they've signed you up for one. So you should monitor your mymedicare.gov account. Before I get too much further along, someone just wrote to me this afternoon and said, my Medicare supplement took a rate increase. They're in the state of Connecticut, if you know who you are. And they're very angry because they're getting a rate increase in January, but they want to know right now, should they do a Medicare Advantage plan or do the rate increase? And they went to Medicare.gov to find out what the rates are for Medicare supplement plans. Even though they're our client already, they went to Medicare.gov because they know we're busy. And the rates on Medicare.gov are stale. They're old rates, which means the rates on Medicare.gov are lower than reality. Medicare.gov is not the central hub of information for Medicare supplement. They never have been. They're trying to put more information out there. They're even doing it in alphabetical order, as if that matters a hill of beans. It doesn't. You need the care and the experience of a trusted person who costs you nothing to work with. That's why I think you should work with my organization, because we are trustworthy and we'll give you both sides and we have access to the best plans across the country. And it's not stale, outdated, horrible explanation from Medicare.gov on the Medicare supplement world. They will push you and force you. And if you've looked at any of their emails this year from Medicare.gov about the Medicare season, they're trying to shove everybody into managed care. They don't know about Medicare supplements, and their website does a horrible job of explaining it. So let us help you, if you will. Our website is the best place to go, not the 800 number. The website can guide you with more information so you can make a decision. And then if you think you want to work with us, you can get on our calendar. And then we have a space worked out for you. If you do get on our calendar, please be polite and keep the appointment or cancel it. It will send you a link and you can cancel the appointment at any time. But cancel it if you're not going to be there. Be there if you're going to be there. We bend over backwards. Today we had one of our agents sick. She had to go home. We scrambled and did everything we can to keep those appointments. And it's very difficult when you're dealing with humans to do that. It's very tough. But we're doing everything we can to keep our word. And again, our service doesn't cost anything. Start on the website if you would. It will probably answer most, if not all, of your questions. Been helping people doing this for 26, 7, 8, 9, 1994. What's the math on that? I don't know. Before that, I was in law enforcement trying to keep people from getting scammed. It's a good, noble profession. I encourage anybody to do this one, not that one. Law enforcement has changed so much. It's gotten so bad. Oh my goodness, what a horrible place to be. But somebody's got to do it. And God bless the people who are putting on a uniform and doing that now. So if there's anything we can do for you, please reach out. On the website is the best place to go. Click on the Medicare Help button if that's where you need to be, and let us help you find the right Medicare plan for you. We won't get back to anybody that's called us before now and just left a message. It doesn't matter if you leave 5 messages or 10 messages or just duplicates that slow us down even more. We're working through it. But those that are already through the website and on the calendar, we're helping those people. For the rest, we'll do our very, very, very best to get back to you in the most amazing amount of time as we possibly can. Wait for our help. It's worth it. God bless you. Thank you so much for being a part. Make sure you're subscribed for updates about Medicare, some interesting stuff coming down the road. Thank you very much. We'll see you on the next one. And here's a video you may have missed.